Welcome to the Aig-Imoukhuede Foundation Podcast. I'm Nonye Egekwu, Programs Associate at the Aig-Imoukhuede Foundation. It's a great pleasure to host this special year-end episode titled The Year in Review, Our Progress, Partnerships and Possibilities. As we close out 2024, this episode offers us invaluable moments to reflect on the Foundation's impact over the past year, our achievements, challenges, and the promising opportunities that lie ahead for us. Joining me today are the remarkable leaders driving the vision of the Foundation. We have Ofovwe Aig-Imoukhuede, the Executive Vice Chair, Bukky Akinsemoyin, Director of Partnerships and Funding, Chioma Njoku, Director of Programs, and Dr. Nonye Egekwu, Director of Health Philanthropy. Together, we'll explore how the Aig-Imoukhuede Foundation has translated its mission of public sector transformation into tangible outcomes and set the stage for an even brighter 2025. Today, we'll be discussing our milestones, insights, and lessons learned, the Foundation's vision for 2025, emerging trends and bold goals, as well as the power of partnerships and how collaboration accelerates progress. Let's dive in. So today we're doing things a little bit different. Everyone on podcast today has had the opportunity to host, and you're on the other side today. So let's ask a little question. How are you guys feeling today now that the spotlight is on you? How does it feel to be on the other side of the mic? Chioma, let's start with you.
I'm just grateful, really, to be a part of the kind of work that we do. I would say it gives me a sense of national pride and leaves me with a feeling of accomplishment. And so I'm excited to share all of it with our listeners.
Ofovwe, how does it feel to be on the other side of the mic? I know you've hosted a lot of episodes this year, so how does it feel to take a back seat of that?
I am just happy not to be in the driving seat today, to be honest. I'm already in a holiday mood, so I'm going to sit back, relax, let you drive, let you just ask the questions, and I respond as I feel. Yeah, thank you.
Bukky, off to a good start. How are you feeling today to be on the other side of the mic?
I am looking forward to Christmas, definitely. And I think for me, I miss the position you're in. I quite enjoy hosting. So, but yes, I'm also enjoying this, being on this side of things as well. Thank you.
And Dr. Nonye, you had the opportunity to host two amazing episodes. So how does it feel to be taking it back seat this time?
It sure feels good to be on this side of the divide today. I think I'm taking Ofovwe's space as well, which is, I'm happy for you to drive this. I look forward to answering the questions and really sharing some of the amazing work we've done at the Foundation with our audience. Thank you.
Thank you, everyone. So let's get started on reflecting. It's been a great year at the Foundation, and I'm sure our audience is eager to hear about our great strides so far. So let's start with Ofovwe. What were the Foundation's strategic goals for 2024, and do you think we're successful in achieving these goals?
Thank you, Namdi. So we had a lot of goals for 2024. And if I were to talk about all of them, we would be here for hours. So I'm just going to speak to a few highlights across different areas of our work. For our work in improving access to primary healthcare, we have a long-term commitment to adopting and revitalizing 23 primary healthcare centers under the Adopt a Healthcare Facility program. And this year, our goal was to establish the first 4 centers in Edo State. I am pleased to say that we successfully accomplished this, refurbishing and equipping the centers with vital equipment and resources, bringing quality healthcare closer to communities. A big part of what we do involves supporting reform efforts across the civil service, and we strongly believe that moving from manual to digital processes is a first and very necessary step to improving public sector efficiency and ultimately achieving better public service delivery. This year, our goal was to ensure that the digitalization of the Office of the Head of the Civil Service of the Federation was successfully closed out. And it is a big testament to the dedication and resilience of my team and the committed civil servants that we work with that we successfully completed the project. One of our long-term strategic goals as an organization is to build a new generation of public sector leaders. And we accomplished quite a few things in support of this goal in 2024. We successfully completed the third class of our executive Public Leaders Program, which we offer in collaboration with the University of Oxford, and we commenced the 4th class in October. We also established our Alumni Association and began to provide ongoing training programs and various opportunities for alumni of our programs. Some of the projects that our alumni have worked on using the learnings they have gained from us have been very successful, and we are proud of the impact that they're having across various segments of the public sector. In terms of our research projects, we are continuing our work on the Nigerian Public Sector Performance Index, which we're working on in partnership with the Nigerian Economic Summit Group. And we also successfully completed an important piece of research on public sector reforms in Nigeria, examining why past reforms have failed. So those are just some of the highlights of our achievements in 2024. Back to you, Nnamdi.
Amazing. I think it's great for our listeners to have heard this insight from you. And I would say one of our big events this year was a national workshop which focused on the findings from the research you spoke on. This workshop saw participation from numerous state and non-state actors, making it a robust event. Ofovwe, could you share with us what are the key gains from this workshop and what are the next steps you see as we move forward?
Yeah, so let me talk a bit about the research first. So our goal with the research was to develop an understanding of the obstacles that prevent reforms from being successful, and then develop playbooks from our research findings to guide future reformers. So the workshop was very useful because it was an opportunity for different stakeholders, as you said, state actors, non-state actors. We had academics, we had public servants, we had private sector leaders present, as well as ministers and so forth. And it was an opportunity for them to share their real life experience of reforms. Following the workshop, we've since held a number of more intimate focus group sessions where we could get more detailed feedback from different stakeholder groups. As a next step, we are consolidating all of the feedback and incorporating it into the existing research findings to create robust playbooks that we hope reformers will find useful as they implement their reform projects in the future. Thank you.
Thank you. Now, Chioma, Ofovwe mentioned earlier about key projects from our alumni from the AIG Public Leaders Program and some of the initiatives that they've worked on that are making impacts in the public sector. Can you share with us just a little about the impact these projects are having? And can you also share how they've improved the lives of everyday citizens in Nigeria?
Thank you, Nnamdi. Speaking to impacts, we've been building the capacity of public sector leaders to ensure a number of things. That one, we have a competent public sector leadership that can rise to key leadership positions where they are able to effect systemic and sustainable change in the public sector. And we've seen a number of our alumni become permanent secretary, directors, and heads of agencies. So that's an impact for us because we can then know that in these key positions, they are driving change as change agents themselves. Other things have happened as a result of our alumni projects are that service beneficiaries are beginning to enjoy better healthcare services, within PHCs and other secondary healthcare facilities. There's also been faster dossier review and license approval within NAFDAC. We've also seen government work processes improve from where they used to be done manually, and with some form of nepotism, to now being done more professionally through the digitalization projects of our alumni within their various public organizations. Very key to mention was the launch of the anti-sexual harassment policy by an alumnus of ours, and it was developed to protect youth coppers and other Nigerians. There's also been improved utilization of government resources by leaders as a result of the directors' training that we've held. These are just a few of the impacts of projects that we have, recorded by our alumni. However, we have other projects besides capacity building projects that have also had significant impact. Ofovwe spoke about the research work that we've done and a few impacts of that research work is that we see a greater citizen awareness of the challenges that exist within the public sector, as a result of which they are beginning to hold the government accountable for the identified gaps within the public sector. We've also seen other non-state partners become more aware of the critical public sector systemic gaps, and we've also seen a growing willingness of the private sector to support the government in closing those gaps. There's also, from the government side, been an increased openness to these private sector players to come in and support them in bridging the gaps that have been identified. In our work with actually working, alongside government to close these gaps, we've seen more seamless work processes for public sector officials. We've seen increased public confidence in the desire of public sector to improve its own value proposition and service delivery. We've also seen commitment to action to reduce personnel and payroll fraud within the service. There's been innovation culture strengthened within the service. And finally, we've also seen increase in the number of public servants who are embodying the core values of the civil service.
It is great to hear that civil servants are trying to embody the key values. Moving on to health philanthropy, one of the foundation's focus areas. Dr. Nonye, this year marked a significant milestone with the revitalization of 4 primary healthcare centers in Edo State. Considering the WHO reports that half the world lacks access to essential healthcare, how does this initiative address such a critical need and move the needle for Nigeria?
Thank you, Nnamdi, for the question. I think that's an excellent question, to be honest. While WHO report has actually said 4.5 billion people, lack access to care, I dare say it's not just access, it's access to quality primary health care. And so in Nigeria, right, where we have about 70% of people living in rural areas, and the PHCs are the closest, the primary healthcare facilities are the closest to these dwellers. We have about 30,000 of these healthcare facilities in the country, but only 20% of them are working optimally. So you see, it's almost like we're sitting on a time bomb. So it's a critical space that we're working in, as a foundation. And our goal really is to improve access to quality primary health care for Nigerians. And with this, we're working across the entire value chain, more or less like the entire 6 building blocks of the healthcare system. Leadership and governance, service delivery, health workforce, health information systems, access to essential medicines, and financing. And so with this goal, we, together with PSHAN, which is the Private Sector Health Alliance of Nigeria, to address this need that you mentioned, our chairman envisioned this beautiful initiative, which is the Adopt a Healthcare Facility Program, ADHFP, as we call it. And the goal of this program really is to ensure that we have one optimally functioning primary healthcare facility in each of the 774 local government areas in Nigeria. That's huge, isn't it? And just like Ofovwe said, as a foundation, we have committed ourselves to revitalizing 23 of these primary healthcare centers in 6 states in the country. And with revitalizing, like I mentioned, it's the entire value chain. It's provision of essential medicines. It is expanding and ensuring that we're building infrastructure. It is ensuring that we're working together with government to hire competent staff and train them. It's so many other things. It's powering the healthcare facilities with renewable energy, among others. This year, we were able to revitalize 4 of these primary healthcare centers and commission them for use together with government. And we did this in Edo State. For us, this is a huge step in the right direction. And we're really grateful, that we could start this off. With the revitalizing of these 4 facilities this year and then opening them up for use in 4 of these local government areas, we have been able to take huge steps in the direction of the achievement of our goal, bringing healthcare services, quality healthcare services to the doorsteps of community dwellers, of Nigerians in Edo State. And so we're doing this, like I mentioned, together. It's really important to note at this point, Nnamdi, that we're doing this together with government. And so at the core of what we're doing, which is working to provide, quality healthcare, is sustaining the gains of this. So to answer your question in one line, which is trying to answer what WHO has mentioned, people definitely lack access to care. And as a foundation, we're plugging in and contributing our own quota to ensuring that we can close this gap and ensure that we're providing and meeting up with the universal health coverage agenda. I'll stop here at this point. Thank you.
Thank you, Dr. Nonye. The one key thing I picked up from what you said, not just providing access to healthcare, but providing access to quality healthcare. I think, if I could, I would say that's something that we need in Nigeria, not just access to healthcare, but quality healthcare. There's a popular African proverb which says, if you want to go fast, go alone. If you want to go far, go together. The breadth and ambition of the Foundation's work demands strong partnerships to create lasting impact. Now, Bukky, partnerships or funding requests aren't always easy to sell, particularly when it comes to public sector transformation. Can you speak to how the Foundation approached building these relationships and what progress we have seen this year?
Thank you, Nnamdi. So yes, Nnamdi, you are correct. It is not an easy task at all. I will tell you that for free. I think with us, especially because of the work we do is so unique. So what we've done this year is, instead of focusing on just finding partners or donors, a big part of our strategy this year has been very much around looking for partners to collaborate with and mobilize resources with. So we're looking to secure the resources that we need to achieve and advance both our goals and the partners' goals as well. And when I say in terms of resource mobilization, I'm talking about, it could be partnerships, it could be donors, or it could be technical expertise partners. It is basically about bringing together everything we need to advance our goals. In building these relationships, what we've done is we've leveraged on our value proposition as a Nigerian-led philanthropic organization with a unique public sector focus to position ourselves as trusted local delivery agents that is also trusted by the government and able to deliver on ground. So stakeholders whose goals and vision aligns with the foundation can see we are the ones to collaborate with, work shoulder to shoulder to help achieve our goals. And this can be seen in the significant increase in our partnerships in both the private and public sectors. For example, our partnership with the Oil Producers Trade Section, the OPTS, who very generously sponsored a federal civil service directors training for 61 directors within the federal civil service. This was delivered by a reputable consulting firm called Phillips Consulting Limited, PCL. We also worked with Microsoft and their implementation partners, Woodlab Foundation, to deliver digital upskilling for federal civil servants. And based on this work that we've done within digital upskilling, other governments or the agencies have heard about it and they've reached out to us and they want to work with us on this digital upskilling. So we'll be looking at doing more of this next year. Thank you.
Thank you, Bukky, for giving us insight into how sustained relationship can tie in our work with building the capacity of the public sector. Now, transforming the public sector is no small feat. And Ofovwe, you would agree with me when I say 2024 has brought its share of successes, but also presented with us some unique challenges. Could you share with us some key lessons we've learned this year and how those key lessons will inform our strategies going forward?
Thank you, Nnamdi. I think for me, 2024 just reinforced one of the major lessons that we have had to come to grips with since we started this work. And it is that in order to achieve our organizational objectives, it is important to be flexible and to be able to pivot where necessary. Being too rigid or committed to a particular path can be counterproductive, especially when you're working within a complicated space like public sector reforms. So while we establish annual goals and have work plans that we commit to, we recognize that sometimes things are just out of our control. And so try as hard as we may, we're not always able to make the progress that we hope to. There's a term in the development space called working with the grain, which is basically a strategy that involves gaining an understanding of the context in which you're operating and then finding ways to effect change within that context. For example, we as an organization, we can't bring our private sector mindset into the public sector and expect change to happen immediately and expect public servants to embrace this private sector mindset. We have had to put ourselves in the shoes of the public servants and understand the reality of their context before preferring solutions. And those solutions have to be geared, have to be adapted to the public sector. I give a lot of credit to my team because it can be frustrating. It can be very frustrating work, but they have learned, to grow thick skins and be resilient and to keep their eye on the goal. So to keep their eye on the objective and find ways to work within whatever solution, whatever situation they find themselves in, to come up with a solution. So I think 2024 just reinforced the fact that a lot of things we cannot control. We just have to figure things out as we go along. Thank you.
Thank you, Ofovwe, for thanking us. We appreciate, we are grateful every time for thanking us for our work. So, Chioma, as we look into the future, you mentioned before that there's growing awareness amongst citizens about the need for reform in the public sector and also healthcare systems. Do you think that this shift will influence our work in the future? And if it does, how do you think it will affect our work?
This growing awareness of the public is one of the impacts of our work. And so, in line with our strategy, we will be providing support to even more federal and state ministries, departments, and agencies to ensure that the public sector is then able to deliver the needed services.
Thank you, Chioma. A very crisp response. Bukky, with all these insights everyone has shared this year on our vision for 2025, what message would you like to share with our stakeholders and organizations considering partner with us?
I mentioned earlier that we have positioned ourselves as the trusted local delivery partner, trusted by government and able to deliver on ground. Ofovwe, Chioma, and Dr. Nonye have also spoken in detail about all the incredible work that we're doing and the impact that we're making. But what this means is that the more we do, the more we're being asked to do. So we have so many requests at both the national and subnational level. In 2025, we will continue to explore mutually beneficial partnerships to increase the foundation's profile and amplify the impact of the work that we're doing, while maintaining relationships we already have with key stakeholders. There is so much more to do, which means our 2025 goals are not only ambitious, they are also audacious. Nnamdi, as you mentioned earlier, we will be seeking partnerships that not necessarily help us to go fast, but help us to go far. We want to increase the reach of our impact and the sustainability of the work we're doing. So as we amplify the work we're doing, we will also be looking at local, national, and global partners who have an interest in what we're doing and believe that a more effective public sector can boost Africa's economic performance and improve the lives of its citizens. So for me, it's going to be all about impact-driven collaborations and long-term sustainability. Please do follow us on our social media channels to see what we're doing and also to contact the foundation or contact me so we can discuss how we can collaborate together. Thank you.
Thank you, Bukky. Well, thank you, everyone. It's been an inspiring discussion that we've had so far. I want to give a big thank you to all our guests, Ofovwe, Bukky, Chioma, and Dr. Nonye. So as we close, do we have any final thoughts, anything to share with our stakeholders about what they should look out for us? So we'll start from Chioma.
I'm really just excited for 2025. Looking back at what we've been able to implement and achieve in our work this year, it gives me great hope that there can be real impacts achieved in the public sector. And for our fellow Nigerians and other Nigerian residents who may have lost hope in the ability of the public sector to do better. I hope that this podcast is able to inspire them by the revealing impacts that we've shared, and look forward to working with all of them next year. Thank you, Nnamdi.
Thank you, Chioma. Dr. Nonye, how many more primary healthcare centers we look forward to onboarding next year?
Thank you, Nnamdi. 2024 was a good year with starting off with 4 of these primary healthcare centers. In 2025, we're looking at an additional 9. And while we know that this is a lot of work, but we know it's possible. In addition, like I mentioned, to the access, 2025 is the year where we intend to ensure that the quality begins to reflect. So I think it's going to be a beautiful year for our beneficiaries and stakeholders who are working together with us to achieve this amazing goal. I look forward to next year. Thank you, Nnamdi.
Thank you, Dr. Nonye. Thank you for emphasizing quality one more time. Bukky, any final thoughts from you?
Thank you, Nnamdi. So as I look ahead at 2025, I'm going to be honest. I am both excited and scared. I tried to look for a word to describe those 2 adjectives, but I couldn't find. So I'm excited and I'm scared because there is so much to do. And as the Funding and Partnerships Director, it means there's a lot sitting on my head to help us achieve what there is to do. So yes, I am excited, but also a bit scared, but I'm very much looking forward to what 2025 is going to bring for both the foundation and the impact we're going to continue to make within the public sector and the health sector. Thank you, Nnamdi.
Okay, as we move forward, what are your final thoughts for us, your great tidings for your team, and your great host?
Thank you very much, Nnamdi. I would just like to thank the entire team, Gap Closing Army, as we like to call ourselves, for your hard work this year, your resilience, as I mentioned, your passion for Nigeria, and for transforming the country for the good of all Nigerian citizens. I also want to say a big thank you to our partners, all the people and organizations who have believed in our work and supported us this year. We look forward to working with you next year and doing a lot more. As Bukky said, 2025 is going to be an exciting year for us, but also terrifying because we are ramping up our projects, our programs. We have very, very ambitious plans for helping to spread digitalization across the public sector. We are aiming to move our capacity building initiatives to the subnational level. So we're going to start working with states. We are going to increase the number of training programs, custom training programs that we are offering across the public sector. So a lot of work. When I look back from when we started to now, I am shocked and amazed at how far we have come. But every single year we get more and more demand because our results are evident. People within the public sector are seeing transformation based on our interventions, and they want us to do even more. So we will be looking for partners to join us as we drive to push the transformation of the Nigerian public sector, because we strongly believe that this is one key solution that will help to address the needs of the Nigerian people. So 2025, the Aig-Imoukhuede Foundation is ready for you. Thank you.
On another great note, we wrap up this special episode of the Aig-Imoukhuede Foundation Podcast. Thank you everyone for joining us. Until next time, stay safe, stay inspired, and let's work together towards a brighter future. Please don't forget to follow, subscribe, and share. For more insight on our work, please visit our website at www.aig-imoukhuedefoundation.org.
This has been an episode of the Aig-Imoukhuede Foundation Podcast. Remember to subscribe, share, and leave us a review if you enjoyed this episode. Until next time, stay inspired and remember that together we can build a brighter Africa.